Hello and welcome to part 6 of spine anatomy. In part 6, we are going to look at radiographs of all of this anatomy that we learned in parts 1 through 5, and hopefully once you start looking at the x-rays, things will start to make a little more sense or be a little easier. So our first slide here is an AP axial C-spine. So what does that tell you? If the word axial is in the name, we must be using a tube angle. Okay, the tube angle has to do with the position of our vertebrae. Remember, they slightly overlap each other in the C-spine, and because we have that compensatory curvature in our cervical spine. Those two factors together mean that we have to use a cephalic tube angle to visualize the intervertebral joint spaces open. Okay, we'll talk more about that in lab. Let's identify some anatomy here. And let me begin by saying, in this projection, you only see C3 through C7. If you want to visualize C1 and C2, remember you have to do the AP open mouth that we talked about a few lectures ago. Okay, so A is pointing to T1. Well, how do I know that? Because look, if you follow it, B is pointing to the first rib. So if there is a rib coming off of that vertebrae, you know that that is a thoracic vertebrae. So A is pointing to T1, which helps me count my cervical vertebrae. 7, 6, 5, 4, 3. Okay, so let's point to C. C is pointing to the fourth cervical vertebrae, which we just identified. D is pointing to the articular pillar of C3. So let's point that out right here. Remember, the articular pillar is that chunk of bone in between the superior articular process and the inferior articular process. And remember, on C1, that's called a lateral mass. And then E is pointing to the spinous process of C2. So we're seeing it through the vertebral body. Okay. Next, let's look at a lateral C-spine. Now, on a lateral C-spine, you must include all 7 vertebrae. Remember, on the AP, you only include C3 through C7. On the lateral, you have to get all 7. Also remember, on a lateral cervical spine, we are seeing the zygapophyseal joints for C2 through C7. Okay, so let's look at the anatomy. A is pointing to the region of the dens, and you can see it outlined in that red dotted line. B is pointing to the posterior arch of C1. Remember, C1 is unique in that it has an anterior arch instead of a body, and it has a posterior arch instead of a spinous process. Now on X-ray, radiographically, the posterior arch looks very similar to a spinous process. So that is one of the tricks we'll use to help count our vertebrae, is we'll count these posterior structures, and we'll talk about that in lab. C is the body of C3. So how do I know that? Again, well, here's 1, 2, 3. So this has got to be my third cervical vertebrae. D is pointing to the zygapophyseal joints between C4 and C5. So let me point those out. Do you see this horizontal black line? That is a zygapophyseal joint, and you can see them here, here, here. And notice this chunk of bone in between the zygapophyseal joints. That's the articular pillar. Remember, the top of the articular pillar is the superior articular process. The bottom is the inferior articular process. Good. E is pointing to the body of C7, and then F, of course, is pointing to the vertebra prominens or the spinous process of C7. Remember here, this picture nicely demonstrates why we need a cephalic tube angle, to make sure that we are visualizing the intervertebral joint spaces nice and open. Okay, let's look at an oblique cervical spine. Do you remember what we visualize in an oblique cervical spine? Well, if you said the intervertebral foramina, you are correct. So remember, the foramina are formed by the inferior vertebral notch of one vertebrae meeting the superior vertebral notch of the vertebrae below. And it forms these really cool circular foramen. Now, this is a 45-degree oblique position. A is pointing to the posterior arch of C1. B is pointing to the intervertebral foramina between C4 and C5. Good, so right here. C is pointing to the pedicle of C6. So remember, the pedicle is that chunk of bone in between the notches. So that is your pedicle. And then D is pointing to the body of C7. Good. All right. Okay, next, let's look at an AP T-spine. So the first thing you should look for in an AP T-spine is you want to count all your vertebrae, because in most adults, you can get all 12 thoracic vertebrae in one image. So there's a couple ways to do this. You look for the ribs. Remember, thoracic vertebrae are unique in that they are the only vertebrae that have articulations with the ribs. So if you can count the ribs here, so here is the last rib. And it's kind of hard to see here, but if this is the last rib, then D has to be T12. So 12, 11, 10, 9, 8, 7. So F would be T7. 6, 5, 4, 3, 2, 1, and G would be T1. I also know G is T1 because if I follow it laterally, look, that's the first rib. So G has to be T1, which means A is the first rib. Okay, so B is the 10th rib. And remember, these are the ribs that are coming right off of the spinal column, so they are posterior ribs. Okay, remember when they come around anteriorly, they kind of curve downward. So we are counting posterior ribs. C is the spinous process of T11. So you're seeing that here. Remember, in the thoracic spine, they point downward. So they often superimpose the vertebral body below. D we talked about, that is T12. E is the intervertebral disc space between T8 and T9. So let's look at E. So E is just pointing to the disc space here. You would count your vertebrae and know that this is T9 and this is T8. So that's all, intervertebral disc space between those two vertebrae. F we already established was T7, and G we established was T1. Notice the nice tight collimation here. There is no need to include the entire chest if we're just looking at that T-spine. Good. Let's look at a lateral T-spine. So in a lateral T-spine, remember, we want to include all 12 thoracic vertebrae. There are exceptions to that, and we'll talk about that more in lab. Sometimes because of the shoulders, it's difficult to visualize the top of the T-spine in a lateral position. So then we would do what's called a swimmers, and we'll talk more about that in lab. What are we visualizing in a lateral T-spine? In addition to the vertebral bodies, we're also seeing those intervertebral foramina. So that's what C is pointing to here. That is the intervertebral foramina, that nice big circle in between T11 and T12. Okay, so B is pointing to the body of T7. Well, how do I know that? Well, let me show you a trick. Do you see the costophrenic angle here? That usually ends at the body of T12. So follow your costophrenic angle, and the vertebral body below it is usually T12. So if this is 12, this is L1. So 12, 11, 10, 9, 8, 7, 6, 5, 4, 3. So A is pointing to T3. And notice 1 and 2 are kind of getting hidden underneath this humeral head. There again, that's when we would do a swimmer's position, which we'll learn in lab. So do you see these circles here? These are your intervertebral foramina of the thoracic spine. Remember, blood vessels and nerves pass through those foramen. Wonderful. Okay, we're going to pause part 6 here. We're going to pick up in part 7, learning some landmarks for positioning of the spine.